This is the Strong is a Mindset podcast, episode number 152. What do you do when you're the strong one, but are falling apart inside? Today, I'm joined by my friend, Dr. Michelle Chestovich, a physician and life coach who lost her sister to suicide in 2021. We talk about mental health, the stigma around asking for help, what real self-care looks like, and what to do when you're not okay. If you've ever thought you had to hold it all together, this one is for you. This is the Strong is a Mindset podcast, where you'll learn how to build both a strong body and a strong mind by eating, moving, and thinking. I'm your host, physician, personal trainer, certified health coach, and certified life coach, Carrie Holland. Hey, how are you? What's new? What's good? So, what's good here? Today, I'm sharing a really important conversation that I think we all need to hear. So, it's May, and it's Mental Health Awareness Month. And in honor of that, this week, I'm joined by my friend, Dr. Michelle Chestovich. Michelle is a family physician turned life coach. You can check her out at mamadoclifecoach.com. And Michelle works with women physicians to reduce stress and burnout. She's a fierce advocate for mental health, and she's also someone who knows firsthand the devastating cost of unspoken pain. Michelle lost her sister to suicide in March of 2021. So this is a powerful episode. We are talking about mental health and why it matters, the stigma that still surrounds it, especially for high-achieving women, and why asking for help can feel so hard even when we absolutely need it. We talk about what real self-care actually looks like and how to come up for air when you feel like you're drowning, and how to start honoring your own needs without guilt. So this episode, it is raw, it is honest, and yes, there are tears, but it is also filled with compassion, support, and hope. So a quick but important note here. So this episode includes discussion of suicide. So please be kind to yourself while listening. And of course, skip this one if you need to. But Michelle's story and her perspective are a reminder that you are not alone. You do not have to do it all, and it is okay to ask for help. I am so grateful for her friendship, for the tireless work that she's doing, and for the message that she's got for you today. So let's get into it. I am so excited to have Michelle Chestovich with me on the podcast. Michelle and I have known each other for a couple years now. We run in some physician coaching circles. We have gotten the chance to meet a couple times at conferences and masterminds, and it all came together because this is May. It's Mental Health Awareness Month. Michelle is very passionate about mental health, and it is just time. So I'm just so excited to have you here. So thank you for being with me, and for our listeners, just thank you for being here, Michelle.
Carrie, this is a delight. I'm very honored to be here to speak to you and your listeners. Your podcast is one of my favorites. When I'm out jogging, I love to listen and be motivated by you. So thank you for all the work that you do.
What I really want to start with is just your story, because your story is so powerful. So I would love if you could just share about your journey from physician to life coach, and just even about your sister. I'm just going to go right there. I want you to be able to tell us what you want us to know. So please just go ahead and share.
Well, I am a family physician in Minnesota, and I've got 4 kiddos. And over the years, I struggled a lot with feeling overwhelmed. And I have always been somebody who enjoys getting out and sweating to take care of my stress. But there came a point where no matter what I did, how many date nights, how much running and how much sleep I was getting, I was still feeling really stressed out. And probably about 5-6 years ago, I got a coach, and I'm like, this is kind of the missing piece of the puzzle to help me with my brain, to look at things differently, because we as high achievers certainly have high expectations for ourselves. And that just helped me calm down so much. I've always been somebody throughout my life who's been pretty high on the anxiety scale, and coaching just helped me so much. And so I was like, oh my gosh, I need to become a coach, because a lot of my colleagues don't understand this. And this is really what helped me feel better as far as feeling burnt out. So that's a lot of the work I do. And talking about our brain and learning about our brain differently than I learned in medical school was so helpful for me. And I was so excited and passionate about sharing this with other physicians who also learned about the neural pathways and all the diseases of the brain, but not how to care for our brain. So that's sort of where that all began. And then my story, where it really just became really amplified, was unfortunately 4 years ago in March of 2021, I lost my youngest sister, Dr. Gretchen Butler, to suicide unexpectedly. And this was like such an upside down flip for our entire family. And we had no idea that she was suffering so tremendously. And so it made me realize, wow, you can look like you have it all together and you're working and you're taking care of your family and your brain cannot be well. And after she died, I learned that we lose 300 to 400 physicians a year to suicide. And so since that time, I have just dug in and been doing more of this work. I'm like, people do not know that this is a huge problem, that we are an at-risk profession. And people need to know that. And we need to start talking about our brain and our mental health, just like we talk about heart health. And we wear red all of the month of October to talk about our heart health. We need to start talking about our brains because there's so many layers of why we have, I think, this higher incidence, but a lot of it is the stigma associated with mental health. So it is my mission on earth to say, hey, we have brains and they too get sick. And in fact, there are lots of things that put us at higher risk, right? So I'm kind of going in circles a little bit, but that is my mission on earth now, is to continue to share Gretchen's story, to say, hey, if this can happen to this woman who appears to have it all together, she's the top of her class, she's the most athletic, she's the most kind, she's the smartest one. Wow, none of us are safe. So thank you for allowing me to share that. I think it's really important for people to hear that just because you look like you're getting by doesn't mean that you truly are.
Yeah. I mean, your story is so powerful, and I can't thank you enough for, even just sharing and being so vulnerable, and even just as you were talking, I don't know that we ever had any conversations in medical school, in residency, in any of my training at all about mental health. It was just kind of brushed. Even in my own life, I'll just throw this in here. When I first sought treatment for depression, it was in medical school. And it was really a stigma. I kept it under wraps. It was very much, we just don't talk about it. So now I appreciate that people like you and others who are so passionate about this are blowing this up and putting a spotlight on it because it matters. So how did all of this change how you approach and how you think about mental health, not just professionally, but even personally, because you've had such a powerful experience?
Yeah, it flipped everything over. Everything that I knew to be true in life, all of a sudden, that's maybe not true anymore. Everything was just under question, including when I went back to work and was caring for my patients. As a family doc, I treat people with depression and anxiety all the time. And, they fill out their PHQ-9 and I ask them questions about the end if they, are having thoughts of hurting themselves or killing themselves. And sometimes people would score a 2, which means that occasionally over the last 2 weeks, they've been having these thoughts. And then I would ask them a follow-up question. Okay, so I noticed this. Do you have a plan? And so many times over the years, women in particular would say to me, well, I would never do it because of my kids. And I used to believe them, because what I will tell you is that Gretchen, who had 3 young kids, loved them more than anything. This has nothing to do with our kids keeping us safe or not loving your family. Gretchen loved all of us tremendously. And she knew that she was loved tremendously. But her brain was so sick that this was the out that it gave her. And so I just think that was really an interesting aha, holy buckets. This can happen to somebody unknowingly, right? Suddenly. But there is usually a lead up to that. So then I just started again as a family doc and I have my preventive hat on all the time. What can we do to prevent this? We can't prevent all of this, but we need to be aware that yeah, we do have depression and anxiety. And why are we ashamed about talking about it? Because we docs think, well, I should be able to handle it myself. I shouldn't need to reach out for help. I guess, I don't know, but if you sprain your ankle horribly and you're hobbling, are you going to just suck that up too? Probably not. If you tweak your back, if you've ever had back problems, I tell you what, it's miserable. I've sought so much care for my back over the years. So what is it about the stigma about our brain? And that's, I don't have the answer other than just to say we need to talk about it.
Well, you hit on such a good point. Why do you think there is still so much stigma around mental health, not just for physicians, especially for physicians, but
yes,
for high achieving women in general? Why do you think there still is so much stigma?
Well, I think especially for high achieving women, we're supposed to be perfect, right? whatever that means. And like, we're not supposed to have any problems, let alone, oh my gosh, I'm, seeing a therapist and taking meds, which by the way, people, like, that's awesome. Like everybody should be like doing help seeking care, right? Like you work with athletes, you work with women and men who want to like take care of their bodies. The brain is a part of the body. And if it's not functioning well, like nothing really works. But back to why do I think there's such a stigma? I think because in the past, like particularly suicide was like a crime. You commit suicide, right? Which by the way, the new language is died by suicide. I don't ever like correct people, but like that's language that I've learned since I lost my sister. And it makes sense. It used to be a crime. Certain religions had things against it. And then I think we've learned over the years, like, oh, no, this is like a disease that the ultimate horrible consequence is death. Also, too, in our medical professional, in our licensing, up until just a few years ago, there's stigmatizing language. Have you ever had a problem with depression? I mean, for goodness sakes, like what is the percentage of women who have postpartum depression or postpartum anxiety and or just we're humans and we get depression and anxiety, right? And so that was very stigmatizing. So people didn't want to say it. There was also very stigmatizing language, I believe, with substances, but they don't ask like, have you ever had a problem with diabetes and blood sugars out of control? That could also affect patient care. So most of the states over the last few years have changed the languaging for licensing, saying, are you currently able to care for patients? Which is so much less stigmatizing because my thought is if you're a physician, by golly, you sure should have a therapist. And if you need to be on medications, great, make sure that they're working for you. So too, if you have high blood pressure or diabetes, that's being cared for. So I think that that's a huge piece of it. And also, I just think that we as doctors, we think that we shouldn't have any problems and that we should be able to like solve our own problems. I don't know. We don't think we should deliver our own babies, but we think that if we have a problem with our brain, maybe we just need to suck it up, get up a little earlier, try a little harder, like we've been trained.
And I think that applies to so many. I mean, just thinking about the women that I work with, so many of the women that I work with, it's the same.
Yeah.
They're saying the same thing. They may have all different professions and different roles. And
that's it.
The underlying theme is the same. I can take care of this. I should be able to take care of myself. And then they start shooting all over themselves. And then it becomes a spiral. I mean, what do you think about that?
That's right. I agree with you 100%. And it is not just physicians. I mean, certainly we have our own little thing, but there are a lot of other high achieving women out there and men. But I think there's something about that needing to do it right and thinking I should be able to do all this. It's just all this societal pressure. Because again, women in particular, if you're a professional woman, you're taught like, have a job like you don't have a family, and then have a family like you don't have a job. Like be Mrs. Cleaver when you come home. That's a lot.
Yes.
That's a lot. And when we start to maybe drop some balls because we think things need to be perfect and Pinterest worthy, we start to think, I'm not good enough. And we get in these spirals that I know you talk about a lot, right? This whole mindset stuff. Now, I like to say anxiety and depression is a disease of the brain. That being said, rumination and thoughts over and over and over again without understanding that those are it's just a pattern and it's not the truth, which I didn't understand until I started coaching. That's where I think it can be dangerous. People can get into this really hopeless state of like, it's never going to get better. People would be better off without me. And they like believe those thoughts because they're thinking them so often. That's where I think it can get dangerous. And that's where I think coaching, or at least talking about our brain, like what is going on in your brain? Like, I didn't even understand that like my thoughts weren't me. I didn't learn that in medical school.
I mean, you bring up such a good point because it wasn't until I got into coaching and therapy, admittedly, that I started really pulling apart thoughts versus reality and thoughts versus stories, and how, I mean, that's really where coaching for me anyway made such a difference, was to be able to pull apart that just because I'm thinking it does not make it fact.
Yes. But when you think it again and again and again, it feels like the truth. Like your people come to you and say, maybe, I can't run. I can't run. I've tried it. I can't run. And that's a belief. And it's so true. The sky is blue. I can't run.
Yeah.
But it's not a truth.
Right.
It's a thought that you've thought a bajillion times. And so some people get into these really dangerous patterns of like, I'm not good enough again and again, which again, you and I have talked about is like at the base of all of our issues. But for some people, it's just a louder sound in the background. Right. And so I do think that talking about it and lowering the stigma can help. Again, I always joke that I was at a conference a few years ago and women were on the beach talking about who should I see? Like my uterus is hanging out. If we can be talking about that along the beaches with friends, right? Or I tweak my back. I'm like, who's the best sports car that I should see for that or whatever?
Mm-hmm.
We should be able to talk about like, hey, what therapist has been really helping you lately?
Yeah.
And or what's your dose of sertraline? That's always kind of my go-to joke, but I don't mean to say it like jokingly. Like
No,
this is
of
just
course not.
like, again, we menopausal women, like how much protein, how much, you know, what's the weight of your weighted vest that you're hiking around in? Why do we talk about that? Because we care about taking care of our bodies. It's equally important for you listeners to realize that your brain is also vital. We get our mammograms, we go to the dentist twice a year, all of these things to take care of our bodies. And you listen to Carrie and you do all the amazing things. I tell you what, I've upped my protein since listening to Carrie. It's amazing because I want to be strong and functionally fit. What are you doing to care for your brain? That's my favorite question.
Yeah. I mean, you hit it, right? Like, I mean, I say it all the time. I think we say the same message. I mean, you can take really great care of your body. You can be the most muscular, jacked person in the room. But if you're not taking care of your brain, you're not truly well. And that your brain, taking care of your brain, that is essential. That's the foundation under which everything else sits. Like that's really it. That's why I wanted you here, because you reiterate this so well. And we have the same message, just in different ways.
Absolutely. It's all a part of the thing. And again, if you're a physician or not, we physicians, like there are jokes all around, like what is the most important organ? Like, is the nephrologist going to fight with the cardiologist? I mean, these are just like, you know, medical humor, right? But like my thought is like, if the brain is not well, like nothing else matters.
Well, and you brought up something else that I want to hit on, because I mean, we see this all the time. When you talk about functioning on the outside, but not on the inside, what do you mean on that? Like, can you talk about what that means to be functioning on the outside, but really not okay on the inside?
The only thing I can speak to is, you know, my sister's story, the best of my understanding. I was not in her brain, but in looking at it retrospectively, this was a woman who had 3 young kids. It was 1 year into COVID. As we all know, they were still like, we had just started getting vaccinated like a couple months prior. We were just going to start coming together as a family again, right? We had been separating to stay safe. She was going to work. She was doing a great job. She was taking care of her family, interacting with her husband, all of the things that you'd think there were not huge red flags that like, wow, she's not getting out of bed, for instance. Mm-hmm. Right. And so she was doing the work and going to work and interacting with people. But meanwhile, I can't imagine that her brain was doing that well on the inside. Right. I don't think that you go from being fine to all of a sudden being dead in a day. I do think for her, it was quite actually impulsive and it was sudden and unexpected. But I think that there must have been some, you know, intrusive thoughts going on ahead of time, right? You don't typically go from like, I'm feeling great to like, I can't be alive anymore. And so I just think it's important to be aware. And the interesting thing for her, the very subtle red flag of a very high functioning woman was that the weekend before she died, she was on call. And I can talk all about sleep deprivation and how her brain was not doing well. I'll mention that in a bit. But prior to this last weekend on call, where she was, you know, she was a radiologist at a level 1 trauma center, reading hundreds of scans for like 17 hours straight. Then she'd get a few hours of sleep and then do it again another day. And prior to that call weekend, I think her anxiety had been building and she reached out to her colleagues and said, hey, I noticed that the interventional radiologists split their call weekend. Would anybody be willing to split the call weekend? And there was crickets. That was her cry for help. She never asked for favors. She never asked for help, really. And again, I was sort of angry at her after she died. Of course, I loved her, but you know, all the emotions come up, which I think we were going to talk about. Like all the emotions come up. And part of it is like, why did you have to be so stubborn and strong and not raise your hand and say, you know what? I feel like I'm drowning. I need help. Because I would have crumbled long ago if I were her. And so it was subtle. She was functioning. I mean, she did an amazing job. And then, of course, they give you that Monday off to like recover from your 36 hours. And what does a mom do who's been working and busy all weekend? She takes care of the house. She cleans. She does the laundry. And again, by the way, she has the most amazing, helpful partner. Like her husband is phenomenal. But that's what she felt she needed to do. And she was so overly tired, she couldn't really rest. So the last time I spoke to her was 3 days before she died. And she said to me, Michelle, I have such a headache. I'm nauseous. I just feel sick to my stomach. I can't even think straight. I said, sweetheart, you are so overly tired. You need to call in sick tomorrow. She said, I can't. We're short at work. This is the mindset of high achievers.
Mm-hmm.
We think that the world absolutely needs us to keep going. But you know what? You can take a break if you're sick. And by the way, our brains need sleep. So many high achieving women are like, they have the to-do lists that are never ending. And like, I'll go to sleep when?
Yeah.
My goodness sakes alive. Your brain needs rest.
Well, and I like one of the things that you, even now in your work now, I know you work with physicians and help them set boundaries, even just around like, this is the time that I'm leaving work, and you have them set a time and that's it. And I think that's so, so important. And I think women need to be told over and over again that it is okay. And in fact, essential for us to be able to set those boundaries, not because it's selfish, not because it's mean, but because we have to take care of ourselves. And I think you do a really great job of putting that out in your podcast and all the material that you put out, just really screaming that message from the rooftops that no, we have to take care of ourselves. It's not just like a luxury and it's not a bubble bath. This is, you must do, like, you've got to do this.
Yeah. And of course, our own internal pressures and societal pressures that we think are so real would have us keep going forever. But unless we decide enough, I am not doing that anymore. Like no one's going to come and tap you on the shoulder and say, you know what? Like, I think it's time for you to go to bed. Nobody's going to do that. And there's always work to be done.
Always.
But just like I tell my clients, you know, the sun comes up and the sun goes down, the to-do list, you know, you get a few things done and there's just going to be more. So like, get yourself in there. And things are so much better when you get sleep. But I think, again, as our society with, I'm not going to like blame it on electricity, but like we could just keep going all day.
Yeah.
But it is really important because I'm so open about talking about it. I've also had about a dozen women come up to me and say, it was almost me when they were feeling exhausted, when they had been working nights or they had been, you know, maybe with a newborn and not getting sleep, all of these things. Like sleep deprivation is torture for a reason. And there's a reason that pilots and truckers have to get sleep. So again, it doesn't matter if you're not a trucker or a pilot or a surgeon. If you are listening to this, but you are just going on fumes, it is not healthy for your brain. Would you eat Doritos and Oreos all day long? Probably not if you're listening to amazing Dr. Carrie Holland. They're fine sometimes is what I would say, but she may have other thoughts. But the point is, you know that that is not good fuel for your body on the regular. So too, getting very minimal sleep is not good for your brain at all.
So
can you tell I'm a little passionate about this?
a little bit. Yes, that's good though. Like when our voices start rising and you got like, yeah, I can see it. I can see it. No, this is it. So what I want to throw out to you and just how you approach this, because I get this all the time is, and I'm sure you hear this too, I don't have time to take care of myself. And I mean, I think, again, to what you said before about thoughts and beliefs, when we say that to ourselves enough times, it becomes our truth, right? So what is your response when somebody tells you, I do not have time to take care of myself? And it feels very true because they go through their schedule. You know, they're working their tails off. How do you address that?
100%. I get it and I respect it. And we need to change the paradigm. Unless you make time for yourself, life is going to continue on. And if you like the way it's going and you're on a treadmill, it's going faster and faster and higher, and it's going great for you and you're enjoying your life, carry on, friend. And if you're like, I want to get off the treadmill and look around, you are welcome to do things. You can change things. And it doesn't have to be drastic. I think sometimes people are like, oh my God, I got to change things 180 degrees. Nope. A 1 to 2 degree dial switch can totally change the trajectory. Even just claiming, I go to bed at 10 o'clock at night, the end. That can make a huge ripple effect difference. So when people say, I don't have time, I'm like, yes, I hear you. And this is your one precious life. Do you like how things are going? If not, very small changes can make a big difference.
So that's exactly it. So what do you say to somebody who feels, because I think the word that comes up for me when so many of my coaching sessions is drowning. I will have clients that tell me they just feel like they're drowning. And because of that, and because they also sometimes blame themselves for the lives that they've created. And so they just feel like they're drowning, but they also created it. And so they feel they don't have any power or authority to even do anything. Like they just feel like their lives are kind of happening to them and they're just kind of swimming through it, holding their head above water. So like, what is it? What can they do I want them to really hear this because this is so important. I feel like so many of the people I work with feel so stuck, so lost, and feel that they do not know what to do and have no capacity to change.
Yeah.
And I want to hear it from you, how you would address.
Well, I've got a tough love message.
That's why I like you, Michelle.
I'm like the big sister tough love message, because I know what it feels like to be drowning and to cry myself to sleep at night thinking I'm not doing a good enough job as a mom, as a doctor, as a wife, all of my titles. I pretty much suck at everything because I got too many balls and they're all dropping and I'm a failure, right? I thought that's kind of how bad it got, right? Just to cry yourself to sleep. No, it can get way worse. And so when people say I don't have time, this is the tough love message. That is a lie. We all have 168 hours per week. And I lovingly say I lived years of my life as the queen of overwhelm. So I totally know how that feels. And you can do things differently. Take back control of your life. When we are at the effect of our life, oh my God, I have so many things going on. Nope. You're the CEO of your life. What are you going to do differently? If you have too many things on your plate, what's one thing that you can remove? Oh my God, I can't. Yes, you can. I know it's uncomfortable. And that's where coaching helps, because the reason we don't make changes is because it's really uncomfortable. But I love to remind people that being where you are, feeling like you're drowning and like a failure is also very uncomfortable. So we may need to learn to disappoint people, to set some boundaries. And you know what? You're not going to die, because this is so important to realize this is my life. And if I don't like it, I can make some changes. Why don't people make changes? But I'm going to disappoint people. If I don't make all the homemade treats for my kids to take to the school or this or that, I'm like, you know what? We got to turn down the dial a little bit. That's where we have to turn. I always talk about, I think I learned it from you about the dial, like turn up the dial, just 1 or 2 degrees, turn down the dial. You don't need to do all the things. You're not going to die. And well, I've got to do all this stuff for my kids. And this is where I'm going to get choked up. Like, what are your expectations for yourself as a mother, for instance? Well, I've got to do this and like have these big parties and go to all their events. I'm like, do you know what your kids want? You.
Yeah.
We just had Mother's Day. And my niece and nephews would just love to have their mom. She doesn't need to do anything special. It would be great if she would be here. And so I think we high achievers think we need to do all of these things. And I am the voice of truth to say, yes, it's hard. You've been doing it this way, but you need to stop it. This is your life. You can make changes. And it really helps to have somebody work along with you. Someone like Carrie, someone like me, someone like all the other people who are willing to say enough is enough. This high achieving, do more world that we live in, we don't have to accept that if it's not right for us.
Love it. I love the tough love because that's just my MO. But I like that you combine the tough love with so much compassion, and you can hear it in your voice. You can see it in your face. Like, yes, the message is tough love, and we have to pull apart the things that we're telling ourselves that are lies, but we do it in such a way that's kind and compassionate, because the whole idea is to take better care of ourselves so that we can be around and be present for the people that we want to be with.
That's right. And you know what? What helped me, again, 5 years ago, was someone outside of me and my brain to say, hey, I hear you saying that that's the truth, but actually it's just a thought you've been thinking over and over again. I was like, what? Are you kidding me? Like every day when I wake up, like, oh my gosh, I have so much to do today. That was like literally my mantra when my alarm would go off. I have so much to do today. I'm so behind. Interesting to have somebody help me understand that, okay, how can we gain back control? And for me, I like objectivity. Like, okay, what are the 5 things, or just get it all out of your brain. What are the things that are spinning in your head? Right. And you teach this so beautifully to your listeners and to your clients. And when they get to work with you, they even get more of that help. I think it's just back to your question that I went sideways on, but like, how do we come out from overwhelm is just understanding that it is possible for it to be different. Your brain is stuck in a pattern of negativity, which of course is what our brains like to do. And it's helpful to have a therapist, a coach, somebody to point that out for us and show us, hey, you're going down this path and it's really quite treacherous. Like, how about we take this way?
So one of the other things I wanted to hit on too was the whole idea of self-care, because I think there's certainly benefits to it. And I think both you and I talk a lot about self-care, but I think that there's nuance to it. And I think for some women, when we talk about self-care, it often gets construed as like one more thing to do and something to put on my to-do list. and ultimately something I'm failing at if they can't do it exactly perfectly, or if they can't go to their yoga class or lift this many weight training sessions a week. Yeah. So for you, what does taking care of your mental health like actually look like? Can you explain like what that really means beyond the buzzword of self-care?
Yeah, no, I love it. And the way I describe it, and it's kind of cheesy, but for the medical professionals, stick with me. And for the non-medical professionals, you're going to learn something today. The heart feeds itself first. The first artery off the heart is not to the big aorta to shoot blood to the rest of our body, but it's the coronary arteries that go to the myocardium, which is the heart muscle. So when we listen to the heart and take care of ourselves first, it's not selfish. Now, like, oh my God, take care of ourselves first. What do you mean? Well, at least get yourself not at the bottom of the to-do list. Because that's where most of us start. When I have time, if I have time at the end of the day, well, then I'll go for that walk. Then I'll, pick up those weights that Carrie talks about. And I just say, like, what if we put ourselves higher up on the to-do list? Because if we don't do it, nobody's going to. So self-care means to me that we are as important as the people that we care for, right? And when you think about it that way, like, oh, well, that makes sense. Because when we're depleted, most of us are just running through life on fumes. That's where that overwhelm and drowning is coming from. We are literally running on fumes. So self-care is filling up the gas tank, if you will. And it's going to be different for all of us. What fills up the gas tank? I mean, for sure, sleep is important. It is not frivolous to be getting 8 hours of sleep. This lady right here needs 9. It's ridiculous, but that's what my body needs. And I make it work. Thankfully, my body actually just shuts down, so I don't have to fight it too hard. So it's just like, okay.
You're done.
How I made it through medical training, I have no idea, but I did. But the point is, sleep is important. What else fills you up? What makes you feel good? And if it's not going to the gym and lifting weights, okay, great. What is it? Is it going for a walk? Is it talking with a loved one? Those are the things that fill you up, that now all of a sudden you have energy to go out and give to others. And I know you talk about this often, but I guess I just talk about self-care as what fills you up.
Because you're right. I agree. It could be different for everybody. I mean, for 100%. Me, and I know you and I share exercising and triathlons and movement in common, but it could be something different for anybody listening.
That's right.
Like it doesn't, you have to find it.
Yeah. For some people, it might be making art. For some people, it might be sitting and reading a book. For some people, it might be, and like we do gain from, for example, if you do volunteer work, like that feels good. But to what point? Like, I mean, I think just it's interesting to like ask yourself, if I was like a tank of gas, like where am I at? Where's my tank at?
Yeah.
Most high achieving women are running down below empty.
Yeah.
Or think about your, battery on your phone, right? Like we charge that sucker up.
Yeah.
So self-care, there's not an answer. And like, sure, if you love to go get a manicure, or you love to like go to yoga or, take a nice bath, great. But that alone for most of us isn't enough. And like once a week going to yoga isn't enough to, I think, do self-care. Because again, I talk a lot about like reducing stress. Like we have stress every day in our lives. So what are you doing to get your stress level down every day? That is self-care. Taking a moment to do some breathing or going for a walk, that is caring for yourself. It's good for your brain. It's good for your body. That's how I sort of describe it.
And you reminded me, I know you've read it and I know you've done a book club on it, but Real Self-Care by Pooja Lakshman, where she talks about how self-care is a state of being, not a state of doing. And I think often we get thrown into this idea that I have to go to yoga, or I have to do my 5-minute meditation, or I have to get my blue dot on the Peloton, or else it doesn't count. And I would just encourage anybody listening that that's not it. That's not it. That's not what we're talking about.
That's right. And I've been there. Like I went to a conference, I don't know, 10 years ago, burnout, and this, physician was saying, well, you got to do meditation every day. So like I would literally like driving, I'm late to work. I get into the parking lot, just my hair's on fire and my heart is racing. I'm like, oh, I got to do my 3-minute meditation. I mean, like how ironic is that? Like I'm sitting in the parking lot, stressed to the max, like, oh, got to get my meditation in. Like it's not a checkbox, but maybe it needs to start that way. But like, again, it's really hard for high achievers to ratchet it way back. It feels kind of like a failure, but like, what's one thing that you could try?
Yeah.
Right? What's one thing that feels good?
Yeah. Just recently, I was talking about like part of this is setting the bar low, which even when I say that out loud for the high achievers, like that is just like, there is immediate pushback. And it's such a hard thing to unlearn because what we've done is pushed ourselves to the max to get to where we are. We didn't get here by going easy. And then
Right.
to unlearn that in order to apply that to our own well-being is a really challenging lesson. So how would you address that? Because I think there's that dichotomy there. It's like, yep, I push really hard in all these other places. So how do I scale it back when we're talking about my soul? Like,
Yeah.
I feel like that's where that can get messy.
And this resonates so much with me because, again, I was on that high achiever, do all the things. And then as I've learned to do this and kind of like dialed it back, at first I had to go through that really uncomfortable, like, oh my God, I'm kind of a slacker. And now I've sort of settled into like, this is my life and I love it. And my soul is happy and my heart is happy and my brain is happy. Sure, I have stress and I get frazzled, all of the things still, of course, I'm human. But I have such now a framework of taking care of myself. And I see how vital it is to take care of ourselves. And again, sleep is so important. Relieving our stress is so important because, again, I have seen what can happen when we neglect ourselves. And again, Gretchen did the best she could. Her brain was really sick, so on and so forth. But what I will tell you is this is a woman who like got all the awards. She had this gorgeous home on a lake. And I'm like, for what? And again, I'm not saying that her beautiful 36-year life wasn't worth living. It was like amazing. Like I am so grateful that I had all those years with her and that she has her 3 beautiful children and her wonderful husband and so on and so forth. So I'm not saying her life was in vain. It certainly was not. But like to achieve all these awards and all these accolades, and then she's not here. Like it's so heartbreaking. I'm like, you guys, you don't need to achieve more. But then again, this is where coaching comes in. We think that achieving all the awards and having the pristine house and the gorgeous garden and the body that looks a certain way is going to make you happy and content in life. I'm afraid to tell you, friends, that's not the truth. You've been listening to Amazing Carrie, and it is the way that you think that creates the way you feel. It is not the money in your bank account, the pounds that you're lifting, the whatever that makes you feel good as a human. And so when I think you start to realize that and you start to incorporate very slowly some of these things, I've learned I feel so much better. And actually now I can tolerate like a little pile on the kitchen counter. Not a lot. Like I don't love clutter, but like it's not now a fault of character of myself. Whereas in the past, it would have been like, oh my God, I'm such a disaster.
I mean, it sounds like this has been your process of healing. Like you're not just like spewing this out, you're walking your talk, you're sharing this and you're able to coach people and help people through this because you're walking your talk.
Yeah.
So can you, I mean, what I'm hearing is like you talking about healing. Can you tell me about what that looks like for you now?
Yes, it has been an amazing, horrible journey. I joke that I have a PhD in grief. I go all in. If somebody has lost somebody, I march right up to them and I give them a hug. I'm like, this is horrible. I'm so sorry. Right. Like, I'm just not afraid. Whereas I think in our society, we are not at all good about being around people who are sad. Right. Or like people can be sad for like a week or two and then like you get back to reality. So like losing my little sister. And when I say little sister, it's because I was 11 when she was born. And so like I was her little mama. And then we grew up and became best friends. And so it was just tragic for everybody. And like everybody in my family deals with it differently, but we've always just been very open about it. And I think for me, part of the healing is just like, say their name, of course. I think a lot of times people are afraid if, maybe one of your friends lost their parent or something, you're afraid to bring it up because you're afraid you're going to make them sad. I'll give you the inside scoop. They're thinking about this person 500 times a day. You're not going to make them sad. They're already sad. It's honoring to bring this person up. So I've just learned that. And so I feel like I can approach other people and just for myself, like, especially in the beginning, there were days like I would just get overwhelmed with grief. They talk about the waves, right? It was like a tsunami at times. Like I would literally fall to my knees, just sobbing. I did a lot of walking. I did a lot of thinking. I did a lot of sitting on my front stoop, talking to my sister. And I've just learned a lot. Like it's okay to be upset. It's okay to be sad. And two, there's still a lot of amazing joy. What's interesting, right? Carrie and I learned with coaching, like the emotions, there's this huge spectrum of emotions. And so for me, allowing grief, I realized it was such an honor to grieve so tremendously because it meant that my love for my sister was tremendous, which totally makes sense. My love was above Mount Everest. So of course my grief is like at the bottom of the ocean, those deep trenches. Of course it is. What an honor. But so interesting when I started to allow that, the joy and the love in my life also increased. Fascinating when you can expand that. Because I've always had like love and, gratitude for my family. It got even more. Also, probably because I realized like, wow, these tragedies can happen. So I really need to be a little bit more mindful and realize like, wow, no, these are really precious times with people that I really love. And so I think I would rather have my sister be here and be in the dark about all of that. But it has been what I would call like one of the gifts of grief is that I can just really expand my capacity for love. And I've always been someone who's expresses it pretty readily, but like even more so. And then another little gift, which I know Gretchen like laughs about because she and I were both sort of high anxiety worriers. How many times over the years do they have those books and things like, don't sweat the small stuff? Like, you tell that to someone who's anxious, like it didn't matter. Like I worried about everything all the time. And now, because with my huge loss, something happens, I'm like, oh, well, no one's dead here. Like this is going to be fine. Like I have this amazing gift now that I totally don't sweat the small stuff and even often the big stuff anymore because it's just like not that big of a deal, which is fascinating because I struggled with that a lot. So thank you, Gretchen, for that additional gift.
I mean, hearing you talk, I'm speechless because just hearing you share all of that is just so powerful and just so, I mean, I have the gift of knowing you and like having been in your presence and having heard you share before, but to hear you put it all into words like that. And, I'm a word nerd anyway and value these words. Like, this is just so awesome. Like, I don't even know what else to say. I'm in total awe and totally gonna start crying, but thank you.
Oh. That's amazing because I'm like, I don't even know what I said because as you know, I just start to like ramble. So I'm not even sure what came out of my mouth, but hopefully it resonates with your listeners. But it is just so true that like life is precious. And I've gotten a lot better at just like every day, like living my life, being in my life. Again, another little gift from Gretchen. And for your listeners who believe in spirits and souls, my sister was an amazing, strong, kind human on earth. And her soul, now unencumbered by her physical body, is like so strong and powerful. And she lets me know she's near. And that also really helps me. My spirituality has soared tremendously since losing my sister. I'm much more of a spiritual person now.
All right. So for anybody who's listening, like I want them to walk away with, okay, I don't know everybody listening and I don't know what their struggles are, but for anybody listening who is struggling or who wants to start prioritizing her mental health and really doesn't know where to begin, what would you offer them? Where should they begin?
Well, I say this often and I don't mean to be cliche, but it's okay to not be okay. Being a human is darn hard. There are a lot of struggles that we deal with finances, with our kids, with our partners, with work, so many things. It is amazing that most of us walking around and functioning sort of.
Yeah.
So if you're thinking, oh my gosh, I'm having a really hard time right now, you are not alone. I also like to let people know that suicidal ideation, thoughts that maybe you'd be better off not here, that maybe your family would be better off without you here, that maybe the pain is never going to get better and that killing yourself would be a way out. Know that you should tell somebody. I've heard statistics that 20 to 30% of people have these thoughts in any given month. That's a lot. Now, this doesn't mean like, oh my gosh, you have to be hospitalized. But if you're having some of these thoughts that might feel a little bit intrusive, it's just a sign that like you should tell somebody and that your brain could use a little extra support. As a family doc, sometimes people would come into me and say, hey, doc, I'm getting a little discomfort when I'm mowing the lawn. I'm getting a little heartburn, a little chest pain. I'm like, oh dear, that's a sign that we need to help their heart. So too, if your brain is telling you these things like people would be better off without you, number one, that's a lie. Number two, it's a sign that you should get some help. So it's okay to not be okay. Tell somebody. And I don't care who do you feel safe and comfortable with? Maybe you tell a dear girlfriend that you walk with, say, you know what, this is kind of uncomfortable to bring up, but I'm just noticing that like, I'm struggling right now, just to normalize it. I personally am a big fan of like making an appointment to see your physician to say, hey, I don't even know what to say, but I'm just not feeling like myself. And they will start to ask you questions and help figure out a plan for you. But I think it really just starts with normalizing, like, you are not broken. You are not the problem. We have human brains and they can get sick. And I remember having patients in my office who'd be crying and crying. And I'd say, yeah, you've got depression and these are the things we can do. But like, but my life is so good. So sometimes it is a lot of like crazy stressors in your life that can flip this over. But sometimes, quote unquote, all is going well. You can still have depression and anxiety that are really affecting your life. So just do an honest check-in with yourself. How am I doing? Am I enjoying life? Not every day, but am I hopefully every day, but like, am I looking forward to things? Am I finding joy in my life? If not, I would advise going in and seeing your physician and or getting in with a therapist and just saying, hey, I'm feeling a little bit off. What are your thoughts on that?
No, I agree. I think, even just normalizing it, I feel like, and I think too, one of the things I've noticed, even just since coaching and being around other high achievers, being around you and being in your circle, like just, we talk about it, like bringing it out in the open.
That's it. And it normalizes it. And I think, and again, I've not struggled very tremendously with mental health. I've always been really prone to anxiety, but over the years, I had girlfriends that we would meet on Saturday mornings and go for a run and then sit for an hour and have coffee. And we would all be chatting about, oh my gosh, this happened. And oh my gosh, my partner did this and this stressor. And oh my gosh, we have this huge bill. And like, but we talked about it. We let it out. We talked about it and we normalized like, oh, I'm not the only one who's having a hard time. We're all having a hard time. I'm like, I always say we're all on the struggle bus of life. So when we start from that premise, like, okay, great. So now what am I going to do next? And if you're not even sure what to do, again, 100% you need to let somebody that you trust know, hey, I need some help. But it can be little things. Just be real honest with yourself. How am I doing right now? And if you're not doing okay, that's okay. It just means you need some help. What if you cracked a tooth? What would you do? You're in pain. I'm not doing so well. Oh my gosh, I need to call the dentist. It wouldn't come up as like a fault of character. But I think our brain health again, there still is stigma. And I just want to let you know that your beautiful brain deserves to be cared for just like the rest of your beautiful body.
We've been like around the block and back again, Michelle. This is great. I really can't thank you enough for what you've said in the last little bit. Like, it's just, again, I'm lucky because I know you already, but then even just to hear you say it again and just to say it in this way has just been so powerful. But to wrap it up, I'm just going to open it up. Is there anything else that you want the listeners to know?
You are an amazing human. And if your brain is telling you otherwise, it's a lie. It's okay to not be okay. And help is available. That's what I really like people to know. Help is available. Let somebody know. If you feel like you're in crisis, 988. Hopefully you've heard about 988. It's the 911 for your brain. They can help connect you if you don't know what to do. But, usually just starting with like letting somebody you care know that you're having a hard time is great. And again, keep listening, right? Moving your body is such a good way to relieve stress, but you can still have a sick brain, right? To your point before, you're like, yeah, you can have the most jacked body in the world and still be suffering. Yeah, of course. Not a problem. There are people who can help you.
Yes.
This is your one precious life. If you don't like how things are going, you can make some changes.
And that's really it. I think we share similar messages in that you do have the authority. It could be really hard sometimes to see it and even believe it. But I think you and I both know that you, the listener, has the authority and has the power to do something different. And it is possible to change. Even though it feels so hard, it is possible. It is 100% possible. Not easy, but possible.
No. And if it feels scary and like unattainable, like you're on the right track.
Yeah.
You are worth it.
Yeah. And I think you've said it multiple times. You don't have to do it alone. There are people here. There are people to support you. You do not have to do this alone. I don't even know how many different people have therapists and coaches I have seen. I don't care. I'm very free with it because that's what got me to where I am now. There's no way I would be where I am now without the help of those people that supported me and helped me, questioned me along the way to help me really see what it was. So I really do agree. There's help and it's hard to ask for it, but it's so important.
Absolutely. I'm so glad that you invited me to come on and talk about mental health. It's so important. May is Mental Health Awareness Month, everybody.
Yes.
Go forth, spread the word.
Yes.
And in fact, I'm just going to keep talking about the brain every day of the year. So
yeah. Well, so Michelle, before we end this, please tell people how they can find you, where to find your things. I know you have obviously your podcast, just tell people where they can find you.
Well, I also have a podcast. You are on as a wonderful guest. I don't recall the episode number, but my podcast is called Remind Yourself. And I just have short little segments every week to talk about different stressors and how to overcome them. I also have a website, www.mamadoclifecoach.com. I help physician women who are feeling burnt out gain back control and get back their nights or weekends. That's sort of my whole mission on earth, is to help women realize yes, I can be a physician and I can have a life outside of that and take care of me too, bring back joy in my life and actually in their job again. So I love the work that I get to do.
Awesome. And you've impacted so many people.
Thank you.
Myself included. So I'm
Thank
grateful.
you. It's an honor. And it's been so fun being on this, parallel journey with you. So You inspire me all the time. So thank you.
Well, right back at you. Thank you so much for being here. If you or someone you love is struggling, please know that you're not alone and there is help available. In the US, you can call or text 988 to reach the Suicide and Crisis Lifeline. It's free, it's confidential, and it's available 24/7. You can also visit 988lifeline.org for more information, resources, and a live chat option if you prefer to text online. And if you're looking for mental health support beyond crisis help, the National Alliance on Mental Illness, or NAMI, has a helpline that you can call at 1-800-950-NAMI, that's 6264, or you can visit NAMI.org for education, support, groups, and more. So please remember that help is available and asking for it is a strength. Thank you for listening to the Strong is a Mindset podcast. If you want to learn more about how to build both a strong mind and a strong body by eating, moving, and most importantly, thinking, check out CarrieHollandMD.com.